The liver is one of the most essential and complex organs in the human body. It performs hundreds of critical functions, including detoxification, metabolism, digestion, and immune regulation. Despite its ability to regenerate, the liver is susceptible to a wide range of diseases caused by lifestyle choices, infections, and genetic conditions. Understanding the liver's role, the diseases that affect it, their causes, and available treatments is crucial for maintaining long-term health. This video explores the liver's functions, common diseases, their underlying causes, and both medical and natural treatment options. The liver is often referred to as the body's chemical factory because of its vast range of metabolic, synthetic, and regulatory activities. Some of its most important functions include detoxification and waste removal. The liver filters toxins, drugs, and metabolic waste from the bloodstream. It breaks down harmful substances and converts them into forms that can be safely eliminated through urine or feces. Metabolism of nutrients. The liver plays a key role in processing carbohydrates, proteins, and fats. It regulates blood sugar levels by converting excess glucose into glycogen for storage and releasing it when needed. It also synthesizes proteins, such as albumin, which helps maintain blood pressure and fluid balance. Bile production and fat digestion. The liver produces bile, which is essential for breaking down dietary fats. Bile is stored in the gallbladder and released into the small intestine to aid digestion and nutrient absorption. Storage of essential nutrients. The liver stores vitamins A, D, E, K, and B12, and minerals such as iron and copper. These reserves are critical for maintaining overall health and metabolic function. Immune function. The liver is involved in immune defense by filtering pathogens from the bloodstream. It contains specialized immune cells, such as Kupffer cells, which help fight infections and remove harmful substances. Hormone regulation. The liver helps regulate hormones, including insulin, estrogen, and cortisol. It also deactivates excess hormones to prevent imbalances that could affect metabolism and overall health. The liver is vulnerable to numerous diseases, ranging from mild inflammation to severe conditions that can lead to organ failure. Some of the most prevalent liver diseases include fatty liver disease, FLD, non-alcoholic fatty liver disease, NFLD caused by obesity, insulin resistance, and metabolic syndrome. NFLD can progress to a more severe condition known as non-alcoholic steatohepatitis, NASH. Alcoholic fatty liver disease, AFLD resulting from excessive alcohol consumption. AFLD can lead to inflammation, cirrhosis, and liver failure. Hepatitis. Hepatitis A, a short-term viral infection transmitted through contaminated food and water. Hepatitis B, a potentially chronic viral infection spread through bodily fluids. Hepatitis C, a serious blood-borne virus that can lead to chronic liver disease and cirrhosis. Cirrhosis. Cirrhosis occurs when long-term liver damage leads to scarring, which reduces liver function. It can result from chronic alcohol consumption, hepatitis, or untreated fatty liver disease. Liver cancer. Hepatocellular carcinoma, HCC, is the most common form of liver cancer, often developing in individuals with chronic liver disease or cirrhosis. Liver failure. This condition occurs when the liver loses its ability to function, either rapidly, acute liver failure, or gradually, chronic liver failure. It is a life-threatening condition requiring immediate medical intervention. Liver diseases can result from various factors, including lifestyle choices, infections, and genetic conditions. The most common causes include poor diet and obesity. Diets high in processed foods, unhealthy fats, and sugar contribute to fatty liver disease and metabolic disorders, increasing the risk of liver damage. Excessive alcohol consumption. Chronic alcohol intake is a leading cause of liver disease, leading to inflammation, cirrhosis, and liver failure over time. Viral infections. Hepatitis B and C are major contributors to chronic liver disease and liver cancer worldwide. Drug and toxin exposure. Certain medications such as acetaminophen, Tylenol, and excessive antibiotic use can cause liver toxicity. Environmental toxins, including pesticides and industrial chemicals, also play a role in liver damage. genetic disorders. Inherited conditions like hemochromatosis, iron overload, and Wilson's disease, copper accumulation, can lead to liver dysfunction if untreated. Treatment for liver disease depends on the specific condition and its severity. Common medical and natural approaches include medical treatments, antiviral medications used to treat hepatitis B and C to prevent liver damage, liver transplant, the last resort treatment for end-stage liver disease, medications for cirrhosis, such as diuretics to manage fluid buildup and beta blockers to prevent complications, dietary and lifestyle changes, balanced diet, emphasizing fruits, vegetables, lean proteins, and healthy fats. Limiting sugar and processed foods helps reduce the risk of fatty liver disease. Hydration. Drinking plenty of water supports liver detoxification. Regular exercise helps maintain a healthy weight and supports liver function. Avoiding alcohol, essential for preventing and managing liver disease. Natural therapies for liver health. Milk thistle contains silymarin, which has antioxidant and anti-inflammatory properties that protect liver cells. Turmeric. Curcumin helps reduce liver inflammation and supports detoxification. Dandelion root, traditionally used to stimulate bile production and support liver detox. Green tea, rich in catechins that support liver function and reduce fat accumulation. Omega-3 fatty acids, found in fish, flax seeds, and walnuts. These reduce inflammation and support liver health. Prevention is key to maintaining a healthy liver. Strategies include regular health screenings, checking liver enzymes to detect early signs of disease. Vaccination, protecting against hepatitis A and B. Safe practices, avoiding needle sharing and practicing safe sex to prevent viral hepatitis transmission. Maintaining a healthy weight, reducing the risk of non-alcoholic fatty liver disease. Avoiding excessive alcohol and drug use, protecting liver cells from damage. The liver is a vital organ that plays a critical role in metabolism, detoxification, and immune defense. While it has a remarkable ability to regenerate, it is also vulnerable to diseases caused by poor lifestyle choices, infections, and genetic disorders. Adopting a healthy diet, avoiding harmful substances, and incorporating natural liver-supporting therapies can help maintain liver health and prevent disease. Understanding and prioritizing liver care is essential for long-term well-being. The liver is one of the most vital organs in the human body, responsible for detoxification, metabolism, digestion, and immune function. Due to the increasing exposure to toxins from processed foods, environmental pollutants, and medications, maintaining liver health is essential for overall well-being. Detoxifying the liver naturally can enhance its efficiency, support digestion, and improve energy levels. This essay explores effective ways to detox the liver naturally through dietary choices, herbal remedies, lifestyle modifications, and holistic therapies. Understanding liver detoxification. Liver detoxification occurs in two primary phases. Phase 1 detoxification. Oxidation enzymes convert toxins into less harmful substances. Phase 2 detoxification. Conjugation toxins are further processed to be excreted via urine, feces, or sweat. Supporting both phases is essential for effective detoxification and overall liver function. Certain foods can naturally cleanse and support the liver. 1. Leafy green vegetables. Spinach, kale, and arugula enhance bile production, helping flush out toxins. Rich in chlorophyll, which absorbs heavy metals and chemicals. 2. Cruciferous vegetables. Broccoli, cauliflower, and Brussels sprouts boost liver enzyme production. Contain sulforaphane, which promotes detoxification. 3. Citrus fruits. Lemons, oranges, and grapefruits are rich in vitamin C, which helps convert toxins into digestible substances. Stimulate liver function and bile production. 4. Turmeric. Contains curcumin, which reduces liver inflammation and enhances bile production. Supports enzyme activity that flushes toxins. 5. Garlic. High in sulfur compounds that activate liver enzymes. Contains selenium, which supports detoxification. 6. Beets and carrots. Rich in beta-carotene and flavonoids, which support liver detox pathways. Enhance bile flow and reduce oxidative stress. 7. Avocados. Contain glutathione, a powerful antioxidant that protects the liver from toxins. Rich in healthy fats that support cell repair. 8. Green tea. Contains catechins, which improve liver function and combat fatty liver disease. Reduces oxidative stress and inflammation. Herbal remedies for liver detox. Several herbs have been traditionally used to support liver function. 1. Milk thistle. Contains silymarin, which protects liver cells and regenerates tissue. Reduces oxidative damage and inflammation. 2. Dandelion root. Acts as a natural diuretic, flushing out toxins. Stimulates bile production and digestion. 3. Artichoke. Enhances liver regeneration and bile production. Protects against oxidative stress. 4. Licorice root. Contains glycyrrhizin, which supports liver enzymes and reduces inflammation. Helps prevent fatty liver disease. Lifestyle modifications for liver health. Making positive lifestyle changes can further enhance liver detoxification. 1. Hydration. Drinking plenty of water helps flush toxins through urine and sweat. Herbal teas and lemon water enhance hydration benefits. 2. Regular exercise. Promotes blood circulation and helps eliminate toxins through sweat. Reduces fat accumulation in the liver. 3. Avoiding processed foods. Limiting sugar, trans fats, and processed foods reduces liver stress. Opt for whole, nutrient-dense foods. 4. Reducing alcohol and caffeine intake. Excessive alcohol strains the liver and leads to fatty liver disease. Opt for herbal teas and water over caffeinated beverages. Holistic detox therapies. Several natural therapies can aid in liver detoxification. 1. Dry brushing. Stimulates lymphatic drainage and circulation, supporting toxin elimination. 2. Intermittent fasting. Gives the liver time to regenerate and process toxins more efficiently. 3. Sauna therapy. Helps release toxins through sweat and improves circulation. 4. Acupuncture. Supports liver meridian energy flow and enhances detox pathways. Detoxifying the liver naturally is an effective way to enhance overall health. By consuming liver-supporting foods, using herbal remedies, staying hydrated, engaging in regular exercise, and practicing holistic therapies, individuals can support their liver's ability to detoxify efficiently. Maintaining a healthy lifestyle and avoiding harmful substances will ensure optimal liver function and long-term well-being. The liver is one of the largest and most vital organs in the human body, playing a central role in metabolism, detoxification, digestion, and blood regulation. It is a highly vascularized organ that receives blood from both the hepatic artery and the portal vein, making it unique in its dual blood supply. Understanding the structure and blood supply of the liver is crucial for comprehending its diverse functions and its role in maintaining homeostasis. The liver is located in the upper right quadrant of the abdomen, beneath the diaphragm and above the stomach, intestines, and gallbladder. It is a wedge-shaped organ, reddish-brown in color, and weighs approximately 1.4 to 1.6 kilograms in adults. The liver is divided into several anatomical and functional sections. Lobes of the liver. The liver is traditionally divided into 4 lobes. Right lobe, the largest lobe, responsible for the majority of liver functions. Left lobe. Smaller than the right lobe, it extends toward the left side of the body. Caudate lobe, positioned near the inferior vena cava, playing a role in venous drainage. Quadrate lobe, located near the gallbladder, it is functionally associated with bile secretion. At the microscopic level, the liver is composed of hexagonal functional units called hepatic lobules. Each lobule consists of hepatocytes, liver cells responsible for metabolic functions. Sinusoids, specialized capillaries that allow blood to flow slowly, facilitating nutrient and toxin exchange. Kupffer cells, resident macrophages that help filter out pathogens and damaged cells. Bile canaliculi, small ducts that collect bile produced by hepatocytes and transport it to larger bile ducts. The liver receives blood from 2 major vessels. 1. Hepatic artery. The hepatic artery originates from the celiac trunk and supplies oxygen-rich blood to the liver. This arterial blood accounts for about 25% of the liver's total blood supply and ensures that hepatocytes receive the oxygen necessary for energy production and metabolism. 2. Hepatic portal vein. The hepatic portal vein carries nutrient-rich blood from the gastrointestinal tract, pancreas, and spleen. This accounts for 75% of the liver's blood supply and allows the liver to process absorbed nutrients before they enter systemic circulation. Venous drainage. Blood exits the liver through the hepatic veins, which empty into the inferior vena cava, returning blood to the heart. This venous drainage is essential for maintaining stable blood composition and regulating glucose and nutrient levels in the body. Biliary system and the liver's role in digestion. The liver produces bile, which aids in digestion and fat absorption. Bile flows through the bile ducts into the gallbladder, where it is stored and concentrated before being released into the small intestine. Clinical significance. Liver cirrhosis. Scarring of the liver disrupts blood flow, leading to portal hypertension and liver dysfunction. Hepatic ischemia. Reduced oxygen supply can damage hepatocytes and impair liver function. Liver transplants. Understanding blood supply is crucial for successful transplantation procedures. The liver's unique anatomical structure and dual blood supply allow it to perform essential metabolic and detoxification functions. By efficiently filtering blood, processing nutrients, and producing bile, the liver maintains homeostasis and supports overall health. Any disruption to its structure or blood flow can have severe consequences, highlighting the importance of liver health and early disease detection. The liver plays a central role in both digestion and metabolism, regulating nutrient processing, bile production, and energy storage. Without the liver's contributions, the body would struggle to break down fats, proteins, and carbohydrates efficiently. This essay explores the liver's role in digestion and metabolism, highlighting its essential functions and their impact on overall health. The liver supports digestion primarily through bile production, which helps break down dietary fats and aids in the absorption of fat-soluble vitamins. Bile production and fat digestion. Bile is composed of bile salts, bilirubin, cholesterol, and phospholipids. It emulsifies fats, making them easier to digest and absorb in the intestines. The gallbladder stores bile and releases it into the small intestine when needed. Nutrient absorption. The liver regulates glucose, amino acids, and lipid metabolism to ensure a steady supply of nutrients for energy production. It processes absorbed nutrients from the gastrointestinal tract before they enter systemic circulation. Metabolism and energy regulation. The liver is a key regulator of metabolism, converting and storing nutrients for future energy needs. Carbohydrate metabolism. Converts excess glucose into glycogen for storage, glycogenesis. Breaks down glycogen into glucose when energy is needed, glycogenolysis. Performs gluconeogenesis, creating glucose from non-carbohydrate sources. Protein metabolism. Deaminates amino acids, removing nitrogen to form urea for excretion. Synthesizes plasma proteins such as albumin and clotting factors. Lipid metabolism. Regulates cholesterol levels by synthesizing and breaking down lipoproteins. Converts excess carbohydrates into triglycerides, which are stored in adipose tissue. Detoxification and waste removal. The liver metabolizes and eliminates drugs, toxins, and metabolic waste products. It converts ammonia, a toxic byproduct of protein metabolism, into urea, which is excreted in urine. Clinical significance. Fatty liver disease. Excess fat accumulation disrupts normal liver function. Diabetes. The liver plays a role in insulin regulation and glucose balance. Metabolic disorders. Liver dysfunction can lead to issues such as hyperlipidemia and insulin resistance. The liver is indispensable for digestion and metabolism. By producing bile, regulating blood sugar levels, metabolizing proteins and fats, and detoxifying harmful substances, it ensures the body functions efficiently. Protecting liver health through a balanced diet and lifestyle choices is crucial for preventing metabolic and digestive disorders. The liver is primarily recognized for its metabolic and detoxification functions, yet it also plays a crucial role in hormone regulation. By metabolizing, synthesizing, and balancing various hormones, the liver ensures that the endocrine system functions properly. Disruptions in liver function can lead to hormonal imbalances that affect metabolism, stress response, reproductive health, and overall well-being. This essay explores the liver's role in hormone regulation, its interactions with the endocrine system, and the impact of liver dysfunction on hormonal balance. The liver regulates several key hormones, including 1. Insulin regulation. The liver helps regulate blood glucose levels by storing and releasing glucose in response to insulin. Insulin resistance, commonly associated with fatty liver disease, can lead to diabetes. 2. Thyroid hormones. The liver converts thyroxine, T4, into its active form, triiodothyronine, T3, which regulates metabolism. Liver dysfunction can lead to hypothyroidism or hyperthyroidism symptoms. 3. Estrogen and testosterone balance. The liver metabolizes excess estrogen and testosterone, ensuring hormonal balance. Impaired liver function can result in estrogen dominance, leading to conditions such as gynecomastia in men and menstrual irregularities in women. 4. Cortisol and stress response. The liver plays a role in metabolizing cortisol, the stress hormone. Liver disease can cause prolonged stress responses, affecting immune function and increasing inflammation. 5. Growth hormone metabolism. The liver produces insulin-like growth factor 1, IGF-1, which is essential for growth and development. Liver impairment can result in stunted growth and metabolic disorders. Liver dysfunction and hormonal imbalance. Fatty liver disease and insulin resistance leads to metabolic syndrome. Cirrhosis and hormone imbalances affects estrogen, testosterone, and cortisol levels. Liver detoxification and endocrine disruption, toxin accumulation can interfere with hormone function. Clinical implications. Hormone replacement therapy and liver function considerations. The impact of liver diseases on reproductive health. The role of diet and lifestyle in supporting hormonal balance. The liver is a key regulator of hormone metabolism and balance. Protecting liver health through proper nutrition, regular exercise, and avoiding toxins can help maintain hormonal equilibrium and overall well-being. The liver and the circulatory system are intricately connected, with the liver playing a vital role in blood filtration, detoxification, and nutrient distribution. As the body's primary blood processing organ, the liver regulates blood composition, produces essential plasma proteins, and removes toxins from circulation. Understanding the liver's relationship with the circulatory system is essential for recognizing its impact on cardiovascular health. Blood flow through the liver. The liver receives blood from two major sources, the hepatic artery and the hepatic portal vein. Hepatic veins return processed blood to the heart via the inferior vena cava. The liver's role in blood detoxification. Filters out metabolic waste, toxins, and excess hormones. Converts ammonia into urea for safe excretion. Plasma protein production. Produces albumin, which maintains blood volume and pressure. Synthesizes clotting factors necessary for wound healing. The liver's impact on heart health. Regulates cholesterol levels by balancing LDL and HDL. Affects blood pressure by producing angiotensinogen, a key component in blood pressure regulation. Liver diseases and cardiovascular implications. Cirrhosis and portal hypertension leads to complications such as varices and ascites. Fatty liver disease and heart disease, increased risk of atherosclerosis and cardiovascular disease. Maintaining liver and circulatory health. Adopting a heart-healthy diet to reduce fatty liver risk. Managing blood pressure and cholesterol through lifestyle changes. The role of antioxidants in protecting liver and vascular health. The liver is integral to circulatory health, filtering blood, producing essential proteins, and regulating cholesterol levels. Protecting liver function can help maintain cardiovascular health and reduce the risk of heart disease. The liver acts as the body's nutrient storage facility, regulating the availability of essential vitamins and minerals. This function ensures a steady supply of nutrients for metabolic processes, immune function, and overall health. Liver dysfunction can impair nutrient storage and distribution, leading to deficiencies that affect various bodily systems. Key vitamins stored in the liver. 1. Vitamin A, essential for vision, immune function, and skin health. The liver stores excess vitamin A to prevent toxicity. 2. Vitamin D, regulates calcium absorption and bone health. The liver converts vitamin D into its active form. 3. Vitamin E, acts as an antioxidant, protecting cells from damage. Stored in liver cells for distribution as needed. 4. Vitamin K, essential for blood clotting and bone metabolism. The liver produces clotting factors that require vitamin K. 5. Vitamin B12, supports nerve function and red blood cell production. The liver stores enough B12 to last several years. Key minerals stored in the liver. 1. Iron, stored as ferritin and released as needed for red blood cell production. Excess iron storage can lead to conditions like hemochromatosis. 2. Copper, necessary for enzyme function and iron metabolism. Imbalance can lead to Wilson's disease or deficiency-related anemia. 3. Zinc, supports immune function, wound healing, and enzyme activity. The liver helps regulate zinc levels in the bloodstream. Impact of liver disease on nutrient storage. Cirrhosis and vitamin deficiencies, reduced storage and absorption lead to complications. Fatty liver disease and nutrient imbalances, impaired metabolism affects vitamin utilization. Alcoholic liver disease and malnutrition, chronic alcohol consumption depletes essential nutrients. Nutritional strategies to support liver health. Consuming a balanced diet rich in whole foods to replenish nutrient stores. Avoiding excessive alcohol and processed foods to protect liver function. Supplementation under medical supervision for individuals with liver disease. The liver plays a vital role in storing and regulating essential vitamins and minerals. Maintaining a healthy liver through proper diet and lifestyle choices ensures adequate nutrient availability, supporting overall health and preventing deficiencies. Alcohol consumption has a profound impact on liver health, affecting millions of people worldwide. The liver plays a central role in metabolizing alcohol, but excessive alcohol intake over time can lead to liver damage, ranging from fatty liver disease to irreversible cirrhosis. This video explores the progression of alcohol-related liver disease, ALD, its causes, symptoms, risk factors, and treatment options. The liver's role in alcohol metabolism. The liver metabolizes alcohol through enzymes such as alcohol dehydrogenase, ADH, and cytochrome P450. This process produces toxic byproducts like acetaldehyde, which can cause oxidative stress and inflammation. Stages of alcohol-related liver disease. Fatty liver disease, steatosis, characterized by excessive fat accumulation in liver cells, often reversible with abstinence. Alcoholic hepatitis, a more severe condition involving inflammation, liver cell damage, and potential liver failure. Fibrosis, chronic inflammation leads to scar tissue formation, reducing liver function. Cirrhosis, the final stage of ALD where extensive scarring disrupts liver function, potentially leading to liver failure or cancer. Risk factors and symptoms. High alcohol intake, genetic predisposition, poor nutrition, and coexisting conditions. Symptoms include jaundice, fatigue, abdominal pain, and swelling. Prevention and treatment. Alcohol cessation, proper nutrition, and medical interventions such as corticosteroids and liver transplants. Understanding the effects of alcohol on the liver is crucial for prevention and early intervention. Lifestyle changes and medical support can significantly reduce the risks associated with ALD. Obesity and diabetes are major public health concerns linked to liver disease. Non-alcoholic fatty liver disease, NFLD, and its more severe form, non-alcoholic steatohepatitis, NASH, are becoming increasingly prevalent due to rising obesity rates. This video examines how obesity and diabetes contribute to liver dysfunction, their complications, and strategies for prevention and management. How obesity affects liver health. Excess body fat leads to fat accumulation in liver cells, causing NFLD. Insulin resistance, commonly seen in obesity, exacerbates liver inflammation and fibrosis. Diabetes and liver disease. Insulin resistance, a key driver of NFLD. Increased inflammation. Chronic high blood sugar damages liver cells. Higher risk of cirrhosis and liver cancer. Uncontrolled diabetes accelerates disease progression. Complications of NFLD and NASH. Liver fibrosis, cirrhosis, and hepatocellular carcinoma. Cardiovascular risks associated with metabolic syndrome. Prevention and management. Weight loss through diet and exercise. Blood sugar control via medication and lifestyle changes. Emerging therapies targeting metabolic pathways. Obesity and diabetes significantly impact liver health. Early intervention through lifestyle modifications and medical treatments can prevent severe liver damage. Many commonly used medications can cause liver damage when taken in excessive amounts or over prolonged periods. Drug-induced liver injury, DILI, is a leading cause of acute liver failure. This video explores medications known for hepatotoxicity, their mechanisms, symptoms, and strategies for prevention. Common hepatotoxic medications. Acetaminophen, Tylenol, leading cause of acute liver failure due to overdose. Nonsteroidal anti-inflammatory drugs, NSAIDs, ibuprofen and aspirin can cause liver damage in susceptible individuals. Antibiotics. Certain antibiotics like amoxicillin clavulanate and tetracyclines are linked to liver toxicity. Statins, used for cholesterol management, but can elevate liver enzymes. Antidepressants and antipsychotics can induce liver enzyme abnormalities and inflammation. Mechanisms of drug-induced liver injury. Direct toxicity from drug metabolites. Immune-mediated reactions causing inflammation. Disruption of bile flow, cholestasis. Symptoms and diagnosis. Jaundice, nausea, fatigue, and liver enzyme elevation. Diagnosed via liver function tests and imaging. Prevention and management. Using medications as prescribed, avoiding unnecessary drug combinations. Regular monitoring for high-risk patients. Detoxification and supportive care for severe cases. Understanding the risks associated with medication overuse and toxicity is crucial for liver health. Safe medication practices and regular health checkups can help prevent liver damage and maintain optimal liver function. The liver is the body's primary detoxification organ, responsible for processing and eliminating toxins. However, increased exposure to environmental toxins has led to a rising prevalence of liver dysfunction and disease. These toxins, which include industrial chemicals, heavy metals, pesticides, and pollutants, can accumulate in the liver, leading to oxidative stress, inflammation, and long-term damage. This essay explores the impact of environmental toxins on liver function, the mechanisms of toxin-induced liver injury, and strategies for prevention and detoxification. Common environmental toxins affecting the liver. 1. Heavy metals, lead, mercury, arsenic, cadmium. Found in contaminated water, industrial emissions, and certain seafood. Causes oxidative stress, mitochondrial damage, and liver fibrosis. 2. Industrial chemicals and solvents. Common in manufacturing, construction, and household products. Exposure to carbon tetrachloride, benzene, and formaldehyde can cause liver cell apoptosis and toxicity. 3. Pesticides and herbicides, used in agriculture and found in food residues. Glyphosate and organophosphates disrupt liver enzyme function and bile production. 4. Air pollutants, particulate matter, polycyclic aromatic hydrocarbons. Emitted from vehicle exhaust, industrial emissions, and cigarette smoke. Linked to chronic liver inflammation and non-alcoholic fatty liver disease. Mechanisms of toxin-induced liver damage. Oxidative stress. Toxins generate reactive oxygen species, RS, damaging hepatocytes. Inflammation. Prolonged exposure activates immune responses, leading to fibrosis. Mitochondrial dysfunction. Disrupts ATP production, affecting liver metabolism. Disrupted bile secretion leads to cholestasis and impaired detoxification. Health effects and liver diseases linked to environmental toxins. NAFLD and NASH, exposure to air pollutants and endocrine disruptors, contributes to fat accumulation in liver cells. Liver fibrosis and cirrhosis. Chronic toxin exposure accelerates scarring and tissue damage. Hepatocellular carcinoma, liver cancer. Certain chemicals, such as aflatoxins, increase the risk of malignancy. Strategies for prevention and detoxification. Reducing exposure, avoiding processed foods, choosing organic produce, and using air purifiers. Liver-supportive diet, including antioxidant-rich foods such as turmeric, green tea, and cruciferous vegetables. Hydration and exercise helps eliminate toxins through urine and sweat. Medical detoxification therapies, chelation therapy for heavy metal poisoning. Environmental toxins pose a significant threat to liver function, contributing to various liver diseases. Understanding exposure sources and implementing detoxification strategies can help mitigate damage and promote long-term liver health. Viral infections are a leading cause of chronic liver disease worldwide. Hepatitis viruses, in particular, can cause long-term liver inflammation, fibrosis, cirrhosis, and even liver cancer. This essay examines how viral infections affect liver function, the progression from acute to chronic liver disease, and available treatments and preventive measures. Common hepatitis viruses and their effects. 1. Hepatitis A virus, HAV. Spread through contaminated food and water. Causes acute liver inflammation but does not lead to chronic disease. 2. Hepatitis B virus, HBV. Transmitted through blood, sexual contact, and from mother to child at birth. Can lead to chronic hepatitis, cirrhosis, and hepatocellular carcinoma. 3. Hepatitis C virus, HCV. Primarily spread through blood transfusions, needle sharing, and medical procedures. Causes persistent liver infection, leading to chronic liver disease in 70 to 85% of cases. 4. Hepatitis D virus, HDV. Only affects individuals already infected with HBV. More aggressive than HBV alone, increasing the risk of severe liver disease. 5. Hepatitis E virus, HEV. Spread through contaminated water and undercooked meat. Usually acute, but can become chronic in immunocompromised individuals. Regression from acute to chronic liver disease. Acute infection. Initial viral replication causes liver inflammation, jaundice, and elevated liver enzymes. Chronic hepatitis. Persistent infection results in ongoing inflammation and liver damage. Fibrosis and cirrhosis. Long-term liver inflammation leads to scarring and impaired liver function. Liver cancer. Chronic hepatitis B and C infections significantly increase the risk of hepatocellular carcinoma. Mechanisms of viral-induced liver damage. Direct viral cytotoxicity. Some viruses directly damage liver cells. Immune-mediated injury. The immune system attacks infected liver cells, contributing to fibrosis. Chronic inflammation. Sustained inflammatory responses promote liver tissue damage and scarring. Prevention and treatment strategies. Vaccination. Effective for HAV and HBV. Antiviral medications, direct-acting antivirals, DAs, for HCV and nucleoside analogs for HBV. Liver transplant, for end-stage liver disease caused by chronic viral infections. Harm reduction strategies, safe injection practices, and blood screening reduce viral transmission. Chronic liver disease caused by viral infections remains a global health challenge. Early detection, preventive measures such as vaccination, and effective antiviral treatments are crucial for reducing disease burden and preventing complications such as cirrhosis and liver cancer. Liver detoxification has become a popular health trend, with countless supplements, diets, and detox programs promising to cleanse the liver. However, many of these claims are not backed by science. The liver is naturally designed to detoxify the body, but its ability can be affected by diet, lifestyle, and overall health. This essay explores the myths and facts about liver detoxification, the science behind how the liver removes toxins, and evidence-based strategies for supporting liver function. How the liver naturally detoxifies. The liver detoxifies through two primary phases. Phase 1 detoxification. Enzymes such as cytochrome P450 convert toxins into less harmful forms. Phase 2 detoxification. The liver attaches molecules, e.g., glutathione, to toxins, making them water-soluble for excretion. Common myths about liver detoxification. Myth: detox teas and supplements cleanse the liver. Fact: the liver does not require special products to function effectively. Myth: fasting flushes out liver toxins. Fact: prolonged fasting may slow metabolism and liver function. Myth: drinking excessive water flushes toxins from the liver. Fact: hydration is essential, but excess water does not enhance liver detoxification. Evidence-based ways to support liver detoxification. Eating a diet rich in antioxidants and fiber. Reducing alcohol and processed food intake. Engaging in regular physical activity. The liver is highly efficient at detoxification when supported by a balanced diet and healthy lifestyle. Understanding the real science behind liver detox can help individuals make informed health choices. Top superfoods for liver health. 1. Leafy greens, spinach, kale, arugula. Rich in chlorophyll, which helps neutralize toxins. Supports bile production for better digestion. 2. Cruciferous vegetables, broccoli, cauliflower, Brussels sprouts. Contain glucosinolates that activate liver detox enzymes. Help reduce oxidative stress. 3. Garlic and onions. High in sulfur compounds that support liver detoxification. Enhance glutathione production. 4. Fatty fish, salmon, sardines, mackerel. Contain omega-3 fatty acids that reduce liver inflammation. Support liver cell membrane integrity. 5. Berries, blueberries, raspberries, cranberries. Rich in antioxidants that protect liver cells from damage. Improve liver enzyme function. Nutrients essential for liver health. Vitamin C and E, found in citrus fruits and nuts. Polyphenol, found in green tea and coffee. Fiber, found in whole grains and legumes. Conclusion: a balanced diet rich in liver-supportive superfoods can enhance liver function and prevent disease. Making mindful food choices is a key component of long-term liver health. Herbal medicine has long been used to support liver health, with plants such as milk thistle and turmeric showing promising benefits. Modern research confirms that certain herbs can enhance liver function, reduce inflammation, and support detoxification. This essay explores the most effective herbal remedies for liver health, their mechanisms of action, and potential risks. Milk thistle, Silybum merianum, contains silymarin, a powerful antioxidant that protects liver cells. Helps regenerate damaged liver tissue. Used to treat fatty liver disease, hepatitis, and cirrhosis. Turmeric, Curcuma longa, contains curcumin, which reduces liver inflammation. Enhances bile production for better digestion. Studies suggest it may help prevent liver fibrosis. Dandelion root, Taraxacum officinale, stimulates bile flow, aiding digestion. Acts as a mild diuretic, helping flush toxins. Artichoke leaf, Cannara scalamus, improves liver enzyme levels and bile production. Protects liver cells from oxidative damage. Precautions when using herbal remedies. Some herbs interact with medications. Overuse may cause digestive issues or toxicity. Always consult a healthcare provider before starting herbal treatments. Conclusion: herbal remedies can be effective in supporting liver health, but they should be used cautiously and in conjunction with a healthy lifestyle. Scientific research continues to uncover the benefits of natural liver-supporting herbs, offering potential complementary therapies for liver conditions. Holistic medicine has long recognized the importance of liver health in maintaining overall well-being. Both Ayurveda and traditional Chinese medicine, TCM, offer comprehensive approaches to liver health through dietary recommendations, herbal therapies, detoxification practices, and lifestyle modifications. These ancient healing systems emphasize balance, prevention, and natural healing, making them increasingly relevant in the modern world. This essay explores how Ayurveda and TCM view the liver, their unique approaches to liver care, and evidence-based benefits of these traditional practices. The liver in Ayurveda. In Ayurveda, the liver is associated with the Pitta dosha, which governs metabolism, digestion, and transformation. Imbalances in Pitta can lead to excessive heat and liver dysfunction, manifesting as inflammation, digestive issues, and skin disorders. 2. Ayurvedic herbs for liver support. Turmeric, Curcuma longa, a powerful anti-inflammatory and antioxidant herb that protects liver cells and enhances bile flow. Kutki, Picrorhiza caroa, known for its hepatoprotective properties. Kutki helps cleanse the liver and improve digestion. Guduchi, Tinospora cordifolia, strengthens liver function and promotes detoxification. Amla, Emblica officinalis, rich in vitamin C and antioxidants. Amla rejuvenates liver cells. Ayurvedic dietary and lifestyle recommendations. Consuming bitter and cooling foods such as leafy greens, aloe vera juice, and coriander. Avoiding excessive spicy, fried, and processed foods that aggravate pitta. Practicing abhyanga, oil massage, with cooling oils like coconut or sunflower to reduce internal heat. Engaging in yoga and pranayama, breathing exercises, to enhance liver function and detoxification. The liver in TCM. TCM views the liver as responsible for the smooth flow of qi, vital energy, and blood. The liver plays a crucial role in emotional regulation, digestion, and detoxification. Stagnation of liver qi can lead to stress, irritability, and digestive imbalances. 2. Key TCM herbs for liver support. Milk thistle, Silybum merinum, protects liver cells and promotes regeneration. Schisandra chinensis, an adaptogen that strengthens liver detox pathways. Bupleurum chinense, used to relieve liver stagnation and support bile production. Dandelion root, Taraxacum officinale, aids in detoxification and inflammation reduction. 3. Acupuncture and liver health. Stimulates liver qi flow to alleviate stagnation. Supports digestion, bile production, and emotional balance. Comparing Ayurveda and TCM approaches. Ayurveda focuses on pitta balance and cooling the liver, while TCM emphasizes qi flow and blood circulation. Both use dietary modifications, herbal remedies, and detoxification practices to support liver function. Emotional well-being is a key component in both systems, recognizing stress as a contributing factor to liver dysfunction. Scientific evidence supporting Ayurveda and TCM. Studies show that turmeric and milk thistle exhibit hepatoprotective properties, reducing oxidative stress and liver inflammation. Acupuncture has been found to improve liver enzyme levels and reduce symptoms of liver disease. Ayurvedic herbs like kutki and amla have demonstrated efficacy in promoting liver detoxification and regeneration. Conclusion. Ayurveda and TCM offer valuable insights into maintaining liver health through natural, holistic methods. By integrating herbal therapies, diet, lifestyle changes, and mind-body practices, these traditional systems provide comprehensive support for liver detoxification and function. Modern research continues to validate these ancient practices, making them a relevant and effective approach to liver wellness. Intermittent fasting, IF, has gained significant attention as a powerful strategy for metabolic health and cellular regeneration. Beyond its benefits for weight loss and insulin sensitivity, IF has profound effects on liver health, particularly in enhancing liver regeneration, detoxification, and fat metabolism. This essay explores the mechanisms by which intermittent fasting supports liver function, the evidence behind its benefits, and best practices for incorporating fasting into a liver-friendly lifestyle. The liver's role in metabolism and detoxification. The liver is central to energy metabolism, breaking down nutrients, storing glycogen, and filtering toxins. However, continuous food intake and poor dietary habits can overload the liver, leading to fatty liver disease and impaired detoxification. IF provides a period of metabolic rest, allowing the liver to repair and regenerate more efficiently. Mechanisms of liver regeneration during intermittent fasting. 1. Autophagy and cellular repair. IF activates autophagy, a process that removes damaged cells and proteins from the liver. Reduces inflammation and oxidative stress, preventing liver fibrosis. 2. Fat mobilization and non-alcoholic fatty liver disease, NFLD, prevention. During fasting, the liver shifts from glucose metabolism to fat metabolism, breaking down triglycerides for energy. Helps reverse fatty liver disease by reducing liver fat accumulation. 3. Enhanced insulin sensitivity and blood sugar control. It lowers insulin levels, preventing insulin resistance, a major contributor to liver disease. Regulates blood sugar, reducing the risk of metabolic disorders. 4. Increased glutathione production and detoxification. Fasting enhances glutathione synthesis, the liver's most powerful antioxidant. Supports detox pathways by promoting bile secretion and phase 2 detoxification. Scientific evidence supporting it for liver health. Studies show that fasting reduces liver fat content by up to 30% in NFLD patients. Animal research indicates that it improves liver enzyme levels and reduces inflammation. Clinical trials suggest that fasting enhances autophagy and liver cell regeneration, slowing the progression of liver diseases. Best intermittent fasting protocols for liver health. 1. 16:8 method. Fast for 16 hours, eat within an 8-hour window. Supports steady blood sugar levels and liver fat metabolism. 2. 5:2 method. Eat normally for 5 days, restrict calories for 2 days. Helps reduce overall liver fat accumulation. 3. Alternate day fasting ADF. Eat one day, fast the next. Enhances autophagy and deep liver detoxification. Precautions and considerations. Individuals with diabetes or liver disease should consult a physician before starting if. Hydration and electrolyte balance are crucial to prevent fatigue and headaches. Breaking the fast with nutrient-dense foods, healthy fats, lean protein, fiber, is essential for sustaining liver function. Conclusion. Intermittent fasting is a scientifically supported method for enhancing liver regeneration, reducing fatty liver disease, and improving metabolic health. By integrating fasting into a balanced lifestyle, individuals can support liver detoxification and long-term health. Future research will continue to uncover the full potential of IF in liver disease prevention and treatment. The liver plays a critical role in maintaining blood sugar, glucose, homeostasis, ensuring that the body has a steady supply of energy. Through processes such as glycogenesis, glycogenolysis, and gluconeogenesis, the liver regulates glucose levels to meet the body's energy demands. Disruptions in liver function can lead to metabolic disorders, including diabetes and insulin resistance. This essay explores how the liver regulates blood sugar, the biochemical pathways involved, and the impact of liver dysfunction on glucose metabolism. The liver's role in blood sugar regulation. The liver functions as a glucose reservoir, releasing or storing glucose as needed to maintain homeostasis. It regulates blood sugar levels through the following processes. 1. Glycogenesis, storing excess glucose. After a meal, excess glucose is stored as glycogen in liver cells. Insulin, secreted by the pancreas, stimulates glycogenesis by activating glycogen synthase. 2. Glycogenolysis, releasing stored glucose. During fasting or periods of low blood sugar, the liver breaks down glycogen into glucose. Glucagon, secreted by the pancreas, triggers glycogenolysis, ensuring glucose availability. 3. Gluconeogenesis, producing glucose from non-carbohydrate sources. When glycogen stores are depleted, the liver synthesizes glucose from amino acids, lactate, and glycerol. This process is essential during prolonged fasting and intense physical activity. Impact of liver dysfunction on blood sugar levels. Fatty liver disease and insulin resistance impair the liver's ability to store and release glucose efficiently. Cirrhosis and glucose metabolism. Reduced liver function disrupts glucose regulation, leading to hypoglycemia. Diabetes and liver health. Chronic high blood sugar levels damage liver cells, worsening metabolic function. Strategies to support liver and blood sugar health. Eating a balanced diet with complex carbohydrates and fiber. Engaging in regular physical activity to improve insulin sensitivity. Avoiding excessive sugar and processed foods to prevent fatty liver disease. Conclusion. The liver is essential for regulating blood sugar levels, ensuring that the body has a continuous energy supply. Maintaining liver health through diet, exercise, and lifestyle choices can prevent metabolic diseases and support optimal glucose homeostasis. Cholesterol is a vital lipid required for cell membrane integrity, hormone synthesis, and bile production. The liver plays a central role in cholesterol metabolism, regulating its production, distribution, and elimination. Imbalances in cholesterol homeostasis contribute to cardiovascular diseases, fatty liver disease, and metabolic disorders. This essay explores how the liver manages cholesterol, the impact of liver dysfunction on lipid metabolism, and strategies for maintaining healthy cholesterol levels. The liver's role in cholesterol metabolism. The liver regulates cholesterol through multiple mechanisms. 1. Cholesterol synthesis. The liver produces cholesterol using acetyl-CoA and the enzyme HMG-CoA reductase. Statin medications target HMG-CoA reductase to reduce cholesterol levels. 2. Lipoprotein transport. Low-density lipoprotein, LDL, carries cholesterol to tissues. Excess LDL contributes to plaque formation. High-density lipoprotein, HDL, removes excess cholesterol and transports it back to the liver for excretion. 3. Bile production and cholesterol excretion. The liver converts cholesterol into bile acids, which aid in fat digestion. Bile acids are reabsorbed or excreted, regulating cholesterol balance. Impact of liver dysfunction on cholesterol management. Non-alcoholic fatty liver disease, NAFLD, alters lipid metabolism, increasing LDL and triglycerides. Cirrhosis reduces bile production, impairing cholesterol elimination. Hypercholesterolemia, poor liver function, leads to excess cholesterol accumulation and atherosclerosis. Ways to support liver and cholesterol health. Consuming fiber-rich foods to bind cholesterol in the digestive tract, including omega-3 fatty acids to improve lipid profiles. Exercising regularly to enhance HDL levels and lower LDL. Conclusion. The liver is fundamental to cholesterol homeostasis, balancing synthesis, transport, and excretion. Supporting liver function through a healthy lifestyle can prevent cholesterol imbalances and reduce the risk of cardiovascular disease. The liver is essential for lipid and protein metabolism, ensuring that fats and amino acids are efficiently processed for energy, storage, and physiological functions. It converts excess nutrients into usable forms, detoxifies byproducts, and maintains metabolic balance. Disruptions in liver function can lead to metabolic disorders, including fatty liver disease and amino acid imbalances. This essay explores how the liver processes fats and proteins, the biochemical pathways involved, and the consequences of liver dysfunction. The liver's role in fat metabolism. Fats are an essential source of energy and structural components for cell membranes. The liver regulates lipid metabolism through the following processes. 1. Lipogenesis, fat storage and synthesis. Excess carbohydrates and fats are converted into triglycerides and stored in adipose tissue. The liver synthesizes lipoproteins to transport fats in the bloodstream. 2. Beta oxidation, fat breakdown for energy. Fatty acids are broken down in mitochondria to generate ATP. This process is crucial during fasting and low carbohydrate intake. 3. Ketogenesis, producing ketone bodies. The liver converts fatty acids into ketones when glucose is scarce. Ketones serve as an alternative energy source for the brain and muscles. The liver's role in protein metabolism. Proteins are broken down into amino acids, which the liver processes for various functions. 1. Deamination and urea cycle. Excess amino acids undergo deamination, removing nitrogen. The liver converts ammonia into urea, which is excreted in urine. 2. Protein synthesis. The liver produces essential proteins, including albumin and clotting factors. Albumin maintains blood pressure and fluid balance. Impact of liver dysfunction on fat and protein metabolism. Fatty liver disease, excessive fat accumulation impairs liver function. Hyperammonemia, impaired urea cycle leads to ammonia buildup, causing neurological issues. Protein malnutrition, liver damage reduces protein synthesis, affecting immune function and healing. Ways to support liver fat and protein metabolism. Consuming balanced macronutrients to prevent excessive fat storage. Staying physically active to enhance fat oxidation. Supporting detoxification with liver-friendly foods like leafy greens and lean proteins. Conclusion. The liver is essential for metabolizing fats and proteins, converting nutrients into energy, and maintaining metabolic balance. Proper liver function is critical for overall health, and lifestyle choices can help preserve its ability to process fats and proteins efficiently. The liver is one of the most vital organs in the body, playing a crucial role in energy metabolism. It processes and converts macronutrients, carbohydrates, proteins, and fats into usable energy. Without the liver's ability to regulate energy supply, the body would struggle to maintain stable glucose levels, protein synthesis, and fat metabolism. This essay explores the biochemical pathways through which the liver converts nutrients into energy, its role in maintaining metabolic balance, and the impact of liver dysfunction on energy metabolism. Carbohydrate metabolism, regulating glucose levels. One of the liver's primary functions is to maintain blood sugar levels through glycogenesis, the process of converting excess glucose into glycogen for storage. Glycogenolysis, the breakdown of stored glycogen into glucose when energy is needed. Gluconeogenesis, the production of glucose from non-carbohydrate sources, such as amino acids and glycerol, during fasting or intense exercise. Through these mechanisms, the liver ensures a steady glucose supply, preventing hypoglycemia and supporting energy demands of the brain and muscles. Fat metabolism, energy storage, and ketone production. Fat metabolism in the liver is essential for long-term energy storage and utilization. The liver converts excess carbohydrates into triglycerides for storage in adipose tissue. Breaks down fatty acids through beta oxidation to generate ATP. Produces ketone bodies when glucose is scarce, providing an alternative energy source for the brain and muscles. This ability to shift between glucose and fat metabolism is essential for energy homeostasis, particularly during fasting and prolonged physical activity. Protein metabolism, amino acids, and energy production. Proteins play a crucial role in energy metabolism, and the liver manages their breakdown and conversion. Deamination, the removal of nitrogen from amino acids to produce energy. Urea cycle converts toxic ammonia into urea for safe excretion. Amino acid conversion. Some amino acids are converted into glucose, gluconeogenesis, or enter the Krebs cycle for ATP production. By managing protein metabolism, the liver ensures that excess amino acids do not accumulate in toxic amounts while also providing an alternative energy source when needed. The impact of liver dysfunction on energy metabolism. Liver diseases such as fatty liver disease, cirrhosis, and hepatitis can impair the liver's ability to convert nutrients into energy, leading to hypoglycemia due to impaired glycogen storage and gluconeogenesis. Fat accumulation and metabolic disorders from disrupted lipid metabolism. Muscle wasting due to inefficient protein metabolism. Conclusion. The liver's role in nutrient metabolism is fundamental to maintaining energy balance in the body. By efficiently converting carbohydrates, fats, and proteins into energy, the liver supports daily bodily functions, physical activity, and survival during fasting states. Understanding how liver function affects metabolism highlights the importance of liver health and preventive care. Liver enzymes serve as critical indicators of liver function and overall health. They play a role in metabolic processes, detoxification, and inflammation response. When liver enzyme levels are abnormal, it can signal underlying liver disease, metabolic disorders, or drug-induced damage. This essay explores the key liver enzymes, their functions, normal levels, and what deviations from the norm indicate about health. Key liver enzymes and their functions. 1. Alanine aminotransferase, ALT. Primarily found in liver cells, ALT helps convert proteins into energy. Elevated ALT levels indicate liver inflammation or damage, often associated with hepatitis or fatty liver disease. 2. Aspartate aminotransferase, AST, found in the liver, heart, and muscles. Unlike ALT, AST is less liver-specific, and elevated levels can indicate muscle damage or liver disease. 3. Alkaline phosphatase, ALP, essential for bile production and bone metabolism. Increased ALP levels may suggest bile duct obstruction, gallbladder disease, or liver tumors. 4. Gamma-glutamyl transferase, GGT. Involved in bile secretion and detoxification. Elevated GGT is commonly linked to alcohol-related liver damage or biliary obstruction. 5. Lactate dehydrogenase, LDH. Plays a role in energy production and cell turnover. Elevated LDH suggests liver cell damage, infections, or anemia. What abnormal liver enzyme levels indicate? High ALT and AST, sign of hepatitis, liver inflammation, or fatty liver disease. Elevated ALP and GGT may indicate bile duct issues, liver congestion, or gallstones. Low liver enzyme levels could point to malnutrition, chronic liver disease, or metabolic imbalances. Factors that affect liver enzyme levels. Alcohol and drug use can elevate ALT, AST, and GGT levels. Obesity and diet. Fatty liver disease leads to enzyme abnormalities. Medications, certain antibiotics, statins, and painkillers can impact liver enzyme levels. Viral infections, hepatitis A, B, and C significantly raise ALT and AST levels. Preventing and managing liver enzyme imbalances. Maintaining a healthy diet rich in antioxidants and fiber. Avoiding excessive alcohol and processed foods. Regular physical activity to prevent metabolic dysfunction. Monitoring liver function through regular health checkups. Conclusion. Liver enzymes serve as important biomarkers for liver function and overall health. By understanding their roles and what abnormalities indicate, individuals can take proactive steps to monitor and protect their liver. Early detection and lifestyle interventions can help prevent liver disease and maintain optimal metabolic function. Exercise is one of the most effective ways to maintain liver health and prevent liver diseases, such as non-alcoholic fatty liver disease, NAFLD, cirrhosis, and hepatitis. Regular physical activity enhances metabolism, reduces fat accumulation, and improves insulin sensitivity, all of which play crucial roles in liver function. This essay explores the best exercise routines for liver health, the science behind their effectiveness, and tips for incorporating them into a daily routine. The science behind exercise and liver health. Exercise influences liver health by reducing liver fat. Physical activity decreases fat accumulation in liver cells, preventing fatty liver disease. Improving insulin sensitivity. Exercise lowers insulin resistance, reducing the risk of liver disease. Enhancing blood flow. Proper circulation supports liver detoxification and nutrient transport. Lowering inflammation. Exercise reduces systemic inflammation, protecting the liver from damage. Best exercise routines for liver health. 1. Aerobic exercise cardio. Activities like brisk walking, cycling, running, and swimming improve heart and liver health. Studies show that at least 150 minutes of moderate-intensity cardio per week reduces liver fat and inflammation. 2. Resistance training, strength workouts. Lifting weights, bodyweight exercises, push-ups, squats, and resistance band workouts enhance muscle mass and glucose regulation. Strength training twice a week improves liver enzyme levels and metabolism. 3. High-intensity interval training, HIIT. Short bursts of intense activity followed by rest periods increase fat metabolism. Effective in reducing liver fat, improving insulin sensitivity, and supporting overall metabolic health. 4. Yoga and flexibility exercises. Reduces stress levels, which in turn lowers inflammation and supports liver function. Certain poses, such as twists and forward bends, stimulate liver detoxification. Tips for incorporating exercise into daily life. Start with moderate activity and gradually increase intensity. Combine different forms of exercise for maximum benefit. Stay hydrated and follow a balanced diet to support liver function. Conclusion. Regular exercise plays a vital role in maintaining liver health by reducing fat accumulation, improving insulin sensitivity, and lowering inflammation. Incorporating aerobic, strength training, HIIT, and flexibility exercises into a weekly routine can significantly enhance liver function and overall well-being. Alcohol is a major contributor to liver disease, with excessive consumption leading to fatty liver, hepatitis, cirrhosis, and liver failure. Choosing an alcohol-free lifestyle can significantly improve liver health, reduce disease risks, and enhance overall well-being. This essay explores the impact of alcohol on liver function, the benefits of abstinence, and tips for maintaining an alcohol-free lifestyle. How alcohol affects the liver. Fat accumulation. Excess alcohol intake leads to fatty liver disease by increasing fat storage in liver cells. Inflammation and fibrosis. Chronic drinking triggers inflammation and scar tissue formation. Toxin buildup. Alcohol is metabolized into acetaldehyde, a toxic compound that damages liver cells. Increased risk of liver cancer. Long-term alcohol use raises the risk of hepatocellular carcinoma. Benefits of an alcohol-free lifestyle for liver health. 1. Reduce liver fat and inflammation. Abstaining from alcohol lowers triglyceride levels in the liver, preventing fatty liver disease. Reduces liver enzyme levels, indicating improved liver function. 2. Enhance liver detoxification. The liver can focus on processing natural toxins without alcohol burden. Increased glutathione production supports detox pathways. 3. Improved metabolism and digestion. Alcohol-free living enhances nutrient absorption and bile production. Helps regulate blood sugar levels, reducing insulin resistance. 4. Lower risk of liver disease. Reduces the risk of cirrhosis, hepatitis, and liver cancer. Improves overall liver function and longevity. Tips for maintaining an alcohol-free lifestyle. Find healthy alternatives, such as herbal teas or infused water. Engage in activities that do not involve alcohol, such as sports or creative hobbies. Seek support from friends, family, or support groups if needed. Conclusion. Living an alcohol-free lifestyle offers significant benefits for liver health, including reduced fat accumulation, enhanced detoxification, and improved metabolism. Avoiding alcohol can protect the liver from long-term damage and promote overall well-being. Stress and sleep are critical factors that influence liver health. Chronic stress and sleep deprivation can lead to metabolic dysfunction, increased inflammation, and a higher risk of liver disease. This essay explores the effects of stress and sleep on liver function, the biological mechanisms involved, and strategies for improving liver health through stress management and better sleep habits. The connection between stress and liver health. 1. Increased cortisol levels. Chronic stress raises cortisol, which can lead to liver inflammation and fat accumulation. High cortisol levels contribute to insulin resistance, a major factor in liver disease. 2. Impact on detoxification. Stress impairs the liver's ability to detoxify chemicals and process nutrients. Oxidative stress caused by chronic stress damages liver cells. 3. Emotional and behavioral effects. Stress often leads to poor dietary choices, alcohol consumption, and lack of exercise, all of which negatively affect the liver. The role of sleep in liver function. 1. Sleep deprivation and liver damage. Lack of sleep reduces melatonin, an antioxidant that protects the liver. Increases risk of fatty liver disease and liver inflammation. 2. Circadian rhythms and liver health. The liver follows a natural rhythm for detoxification and regeneration. Irregular sleep disrupts these processes, leading to metabolic issues. 3. Sleep's role in liver regeneration. During deep sleep, the liver performs its highest level of detoxification. Promotes bile production and digestion. Strategies to improve liver health through stress and sleep management. Practicing mindfulness and relaxation techniques to lower cortisol levels. Engaging in regular exercise to relieve stress and support liver function. Establishing a consistent sleep routine to enhance liver detoxification. Reducing caffeine and electronic device use before bedtime to improve sleep quality. Conclusion. Managing stress and maintaining healthy sleep patterns are essential for liver health. Chronic stress and sleep deprivation increase the risk of liver disease, while proper stress management and restorative sleep support detoxification and metabolic function. Implementing lifestyle changes to reduce stress and improve sleep can lead to better overall liver health and long-term well-being. The liver is one of the most vital organs in the body, playing a central role in detoxification, metabolism, and immune regulation. While its primary functions relate to internal biochemical processes, the liver also has a significant impact on skin health. Many skin conditions such as acne, eczema, psoriasis, and jaundice are linked to liver dysfunction. Understanding the connection between liver health and skin conditions can provide insights into the importance of liver care for maintaining clear and healthy skin. This essay explores how liver dysfunction manifests through the skin, the biological mechanisms behind these manifestations, and ways to improve skin health through liver support. How liver dysfunction affects the skin. 1. Impaired detoxification and toxin accumulation. The liver is responsible for filtering toxins from the blood. When it becomes overburdened or damaged, these toxins accumulate in the body and may be expelled through the skin, leading to conditions such as acne. Excess toxins and hormonal imbalances contribute to breakouts. Eczema and psoriasis, inflammatory responses linked to liver dysfunction, can trigger these skin conditions. Jaundice, yellowing of the skin and eyes due to excess bilirubin buildup in the bloodstream. 2. Hormonal imbalances. The liver metabolizes hormones, including estrogen and androgens. Liver dysfunction can lead to hormonal acne. Excess androgens stimulate sebum production, clogging pores. Melasma, dark patches on the skin due to estrogen imbalances. 3. Inflammation and oxidative stress. A sluggish liver contributes to systemic inflammation, leading to skin redness and sensitivity. Increased inflammatory markers cause rosacea-like symptoms. Delayed wound healing. Impaired liver function slows down skin regeneration. Skin conditions associated with liver disease. Spider angiomas, small, web-like blood vessels on the skin linked to liver cirrhosis. Itchy skin, pruritus. Bile accumulation due to liver disease can cause persistent itching. Pale or dark patches indicate nutrient deficiencies due to poor liver function. How to improve skin health by supporting the liver. Dietary changes. Increase consumption of liver-supporting foods like leafy greens, turmeric, and beets. Hydration. Drinking adequate water helps flush toxins from the liver. Liver detoxification. Natural detoxifiers like milk thistle and dandelion root improve liver function. Avoiding processed foods and alcohol, reducing liver stress leads to clearer skin. Conclusion. The liver and skin share an intricate connection, with liver dysfunction often manifesting through skin problems. Addressing liver health through dietary and lifestyle changes can significantly improve skin conditions and overall well-being. Taking a holistic approach to liver care ensures not only internal health, but also a clear and radiant complexion. Smoking is well known for its detrimental effects on the lungs and heart, but its impact on the liver is often overlooked. The liver plays a crucial role in metabolizing toxins, including those from cigarette smoke. However, chronic smoking places excessive stress on the liver, leading to reduced function, increased inflammation, and a higher risk of liver disease. This essay explores how smoking affects the liver, the biochemical mechanisms involved, and the long-term health risks associated with smoking-related liver damage. The liver's role in detoxification and how smoking disrupts it. The liver is responsible for breaking down and eliminating harmful substances, but smoking introduces thousands of toxins, including nicotine, alters liver enzyme activity, affecting drug metabolism. Carbon monoxide reduces oxygen supply to liver cells, impairing function. Carcinogens promote liver cell damage and increase the risk of cancer. Effects of smoking on liver function. 1. Increased liver enzyme levels. Smoking raises levels of liver enzymes such as ALT and AST, indicating liver stress. Chronic liver enzyme elevation is associated with fatty liver disease and hepatitis. 2. Higher risk of liver fibrosis and cirrhosis. Smoking accelerates the progression of liver scarring, leading to cirrhosis. Reduced oxygen supply to the liver cells impairs their ability to regenerate. 3. Impaired bile production and cholesterol regulation. Nicotine and tobacco toxins affect bile secretion, leading to digestive issues. Increases the risk of gallstones and cholesterol imbalances. 4. Higher risk of liver cancer. Smoking introduces carcinogens that increase the likelihood of hepatocellular carcinoma, HCC. Combined with alcohol consumption, the risk of liver cancer significantly escalates. How smoking contributes to liver diseases. Non-alcoholic fatty liver disease, NAFLD. Smoking exacerbates fat accumulation in the liver. Hepatitis C progression. Smokers with hepatitis C experience faster disease progression. Oxidative stress and inflammation leads to chronic liver damage and reduced immune function. Ways to protect the liver from smoking-related damage. Quitting smoking, the most effective way to reduce liver disease risk. Antioxidant-rich diet. Foods like berries, nuts, and green tea combat oxidative stress. Regular exercise improves liver function and reduces fat accumulation. Medical monitoring. Regular liver function tests can help detect early signs of damage. Conclusion. Smoking has profound negative effects on liver health, contributing to fibrosis, cirrhosis, and liver cancer. The best way to protect the liver from these harmful effects is to quit smoking and adopt a healthy lifestyle that supports liver function. Understanding the impact of smoking on the liver reinforces the importance of tobacco cessation for overall health and longevity. The liver and the gut microbiome share a dynamic and intricate relationship that significantly impacts overall health. The gut microbiome consists of trillions of microorganisms that influence digestion, immune function, and metabolism. The liver, as a central organ in detoxification and metabolism, is constantly interacting with the gut via the portal vein, which transports nutrients, toxins, and microbial metabolites. Disruptions in the gut microbiome can lead to liver diseases such as non-alcoholic fatty liver disease, NAFLD, cirrhosis, and liver fibrosis. This essay explores the complex connection between liver health and the gut microbiome, highlighting their bidirectional communication, the role of dysbiosis in liver diseases, and strategies to maintain a healthy gut-liver axis. The gut-liver axis, a bidirectional relationship. The gut-liver axis describes the constant exchange of signals between the gastrointestinal tract and the liver. The primary pathways through which this interaction occurs include: the portal vein transports microbial metabolites, bile acids, and nutrients from the gut to the liver. Bile acid metabolism. The liver produces bile, which is modified by gut bacteria to regulate digestion and liver function. Immune system regulation. The gut microbiome influences liver inflammation and immune responses. The impact of gut dysbiosis on liver health. Gut dysbiosis, or an imbalance in the gut microbiome, can negatively affect liver function through various mechanisms. Increased intestinal permeability. A weakened gut barrier allows bacterial endotoxins, such as lipopolysaccharides, to enter the liver, triggering inflammation. Microbial metabolites, short-chain fatty acids, SCFAs, and other metabolites can either benefit or harm liver cells. Overgrowth of harmful bacteria. Certain bacteria promote liver fat accumulation and inflammation, leading to NAFLD. Liver diseases linked to gut microbiome imbalance. NAFLD and NASH. Gut microbiome imbalances promote fat accumulation and inflammation in the liver. Liver cirrhosis. Dysbiosis contributes to the progression of liver fibrosis and cirrhosis. Hepatic encephalopathy. Imbalanced gut bacteria produce toxins that affect brain function in liver disease patients. Strategies to improve gut and liver health. Probiotics and prebiotics support beneficial gut bacteria and improve liver function. Dietary fiber enhances gut microbiome diversity and liver metabolism. Limiting processed foods and alcohol reduces gut inflammation and liver stress. Exercise promotes gut health and reduces liver fat accumulation. Conclusion. The gut-liver axis plays a crucial role in maintaining metabolic and immune balance. Supporting gut health through a balanced diet, probiotics, and lifestyle changes can significantly enhance liver function and prevent disease progression. Bile is a vital digestive fluid produced by the liver and stored in the gallbladder, playing a crucial role in the digestion and absorption of fats and fat-soluble vitamins. Any disruption in bile production or secretion can lead to digestive disorders, malabsorption, and liver dysfunction. This essay explores the importance of bile production, its role in digestion, factors affecting its secretion, and ways to support optimal bile function. The composition and functions of bile. Bile consists of bile salts, essential for emulsifying fats, Cholesterol maintains bile composition and fat digestion. Bilirubin, a waste product from red blood cell breakdown. Phospholipids and electrolytes aid in bile fluidity and function. Role of bile in digestion and nutrient absorption. Fat digestion. Bile emulsifies fats, breaking them down into smaller molecules that enzymes can process. Vitamin absorption. Fat-soluble vitamins A, D, E, and K require bile for proper absorption. Cholesterol regulation. Bile helps maintain cholesterol balance by facilitating its excretion. Detoxification. Bile removes toxins and waste products from the liver. Factors affecting bile production and flow. Dietary choices. Low-fat diets can reduce bile production, while high-fat diets may increase bile secretion. Gallbladder dysfunction. Gallstones and inflammation can obstruct bile flow. Liver disease. Conditions like hepatitis and cirrhosis impair bile synthesis. Consequences of bile deficiency. Fat malabsorption leads to deficiencies in essential fatty acids and vitamins. Digestive disorders causes bloating, gas, and diarrhea. Gallbladder disease. Chronic bile stagnation increases gallstone risk. Ways to support healthy bile production. Consuming bitter foods, dandelion, artichokes, and dark leafy greens stimulate bile production. Staying hydrated ensures proper bile fluidity. Healthy fats. Moderate intake of healthy fats, avocados, nuts, olive oil, promotes bile secretion. Conclusion. Bile production is essential for efficient digestion, nutrient absorption, and detoxification. Maintaining liver and gallbladder health through proper diet and lifestyle choices ensures optimal bile function and overall digestive well-being. The liver and gut are closely interconnected, forming the liver-gut axis, a system that regulates immune responses, metabolism, and inflammation. Chronic inflammation plays a key role in liver diseases such as fatty liver disease, cirrhosis, and hepatitis. This essay explores how gut-derived inflammation contributes to liver disease, the mechanisms involved, and strategies for reducing inflammation to promote liver health. How gut inflammation affects the liver. Increased intestinal permeability, a leaky gut, allows bacterial endotoxins to enter the liver, triggering immune responses. Endotoxemia, the presence of bacterial toxins in the bloodstream promotes liver inflammation. Dysregulated immune system, chronic inflammation impairs liver function and accelerates disease progression. Major liver diseases linked to inflammation. Non-alcoholic fatty liver disease, NFLD. Chronic inflammation leads to liver fat accumulation and fibrosis. Alcoholic liver disease, alcohol-induced inflammation damages liver cells. Hepatitis, viral and autoimmune hepatitis involve immune-mediated liver inflammation. Role of the microbiome in liver inflammation. Beneficial bacteria maintain gut barrier integrity and prevent inflammation. Pathogenic bacteria increase endotoxin levels, worsening liver conditions. Dysbiosis leads to immune dysregulation and inflammatory liver diseases. Strategies to reduce liver inflammation. Probiotic and prebiotic intake strengthens gut barrier and reduces endotoxin leakage. Anti-inflammatory diet, rich in omega-3 fatty acids, fiber, and antioxidants. Reducing alcohol and processed foods minimizes gut inflammation and liver stress. Regular physical activity lowers systemic inflammation and supports liver detoxification. Conclusion. The liver-gut axis plays a crucial role in inflammation and liver disease progression. Understanding the impact of gut-derived inflammation on liver health highlights the importance of gut microbiome balance and anti-inflammatory strategies for preventing liver conditions and improving overall health. The gastrointestinal (GI) tract and the liver share a crucial and complex relationship known as the gut-liver axis. This axis allows for the exchange of nutrients, metabolites, and immune signals between the gut and the liver. One of the major health conditions affecting this axis is leaky gut syndrome, LGS, a condition characterized by increased intestinal permeability, allowing harmful substances to enter the bloodstream. When the gut barrier is compromised, toxins, bacteria, and undigested food particles can leak into circulation, overloading the liver and leading to dysfunction. This essay explores the link between leaky gut syndrome and liver dysfunction, the underlying mechanisms, and strategies for prevention and management. Understanding leaky gut syndrome. Leaky gut syndrome occurs when the intestinal lining becomes damaged, allowing bacteria, toxins, and other harmful substances to pass through the gut barrier into the bloodstream. Contributing factors include poor diet, high consumption of processed foods, sugar, and unhealthy fats. Chronic stress increases inflammation and weakens the gut barrier. Dysbiosis, imbalances in gut bacteria contribute to intestinal permeability. Toxin exposure, chemicals, heavy metals, and pollutants damage the gut lining. The gut-liver axis and how leaky gut affects the liver. The gut-liver axis connects the gut microbiota and liver function. When gut permeability increases, the liver is exposed to an overload of harmful substances, leading to endotoxemia, lipopolysaccharides, LPS, from bacteria enter circulation and trigger liver inflammation. Increased liver inflammation. Chronic immune activation leads to liver fibrosis and fatty liver disease. Reduced detoxification. Overburdening of the liver reduces its ability to process and eliminate toxins. Liver diseases linked to leaky gut syndrome. Non-alcoholic fatty liver disease. NFLD excess toxins and inflammation contribute to liver fat accumulation. Hepatitis and fibrosis. Persistent inflammation from gut bacteria leads to chronic liver damage. Cirrhosis. Long-term exposure to gut-derived toxins accelerates liver scarring. How to manage and prevent leaky gut-induced liver dysfunction. Probiotics and prebiotics support gut microbiome diversity and strengthen the gut barrier. Anti-inflammatory diet includes whole foods, fiber, and omega-3 fatty acids. Reduce alcohol and sugar intake, minimizing gut and liver inflammation. Regular exercise enhances metabolism and gut health. Conclusion. Leaky gut syndrome is a major contributor to liver dysfunction due to its impact on inflammation, endotoxemia, and impaired detoxification. By supporting gut health through diet, probiotics, and lifestyle changes, individuals can protect both their gut and liver function, reducing the risk of chronic liver disease. Dietary fiber is a crucial nutrient for overall health, particularly for the digestive system and liver function. Fiber plays a vital role in maintaining a healthy gut microbiome, regulating cholesterol levels, and reducing liver inflammation. A high-fiber diet is associated with a lower risk of liver disease, including non-alcoholic fatty liver disease, NAFLD, and cirrhosis. This essay explores the benefits of dietary fiber for liver health, the mechanisms involved, and recommendations for incorporating fiber-rich foods into a liver-friendly diet. The role of fiber in liver health. Fiber benefits the liver in multiple ways. Regulating blood sugar levels. Fiber slows glucose absorption, reducing insulin resistance. Lowering cholesterol. Soluble fiber binds to bile acids, promoting cholesterol elimination. Supporting gut microbiota. Fermentable fiber feeds beneficial gut bacteria, improving digestion and liver function. Enhancing detoxification. Fiber aids in the elimination of toxins through stool, reducing liver workload. Types of fiber and their benefits for the liver. Soluble fiber, found in oats, beans, apples, and carrots, it lowers cholesterol and improves insulin sensitivity. Insoluble fiber, present in whole grains, nuts, and vegetables, it aids in digestion and waste elimination. Prebiotic fiber supports gut bacteria, reducing inflammation and liver stress. Liver diseases prevented or managed by fiber. NFLD, a fiber-rich diet reduces fat accumulation in the liver. Cirrhosis helps manage digestive complications associated with liver scarring. Hepatic encephalopathy, prebiotic fiber lowers ammonia levels, benefiting liver disease patients. Best fiber-rich foods for liver health. Legumes, lentils, chickpeas, and beans for soluble fiber. Whole grains, brown rice, quinoa, and whole wheat bread. Vegetables and fruits, leafy greens, berries, and bananas support gut and liver health. Nuts and seeds, chia seeds, flax seeds, and almonds provide fiber and omega-3s. Tips for increasing fiber intake. Gradually increase fiber consumption to prevent digestive discomfort. Drink plenty of water to aid fiber digestion. Incorporate a variety of fiber sources for optimal liver support. Conclusion. Dietary fiber is essential for liver health due to its role in blood sugar regulation, cholesterol management, and gut microbiome support. By including fiber-rich foods in the diet, individuals can reduce the risk of liver disease, support detoxification, and promote long-term well-being. Liver function tests, LFTs, are a set of blood tests used to assess the health of the liver by measuring levels of enzymes, proteins, and bilirubin in the blood. These tests help diagnose liver diseases, monitor treatment effectiveness, and determine overall liver function. This essay explores the different types of liver function tests, their significance, and what they reveal about liver health. Key liver function tests. 1. Alanine aminotransferase, ALT. ALT is an enzyme found primarily in liver cells. Elevated levels indicate liver cell damage, often seen in conditions such as hepatitis and non-alcoholic fatty liver disease, NAFLD. 2. Aspartate aminotransferase, AST. AST is found in the liver, heart, and muscles. Higher levels suggest liver inflammation or damage, though AST is not as specific to the liver as ALT. 3. Alkaline phosphatase, ALP. ALP is an enzyme involved in bile duct function. Elevated ALP levels suggest bile duct obstruction, liver tumors, or bone disorders. 4. Gamma-glutamyl transferase, GGT. GGT is associated with bile ducts and liver function. High GGT levels indicate bile duct obstruction, chronic alcohol use, or liver disease. 5. Bilirubin. Bilirubin is a byproduct of red blood cell breakdown. Increased bilirubin levels cause jaundice and indicate liver dysfunction or bile flow issues. 6. Total protein and albumin. The liver produces albumin and other proteins. Low levels suggest chronic liver disease, malnutrition, or kidney disease. What liver function tests reveal? Hepatitis and liver infections, elevated ALT, AST, and bilirubin levels. Bile duct issues. High ALP and GGT levels suggest obstruction. Chronic liver disease and cirrhosis, low albumin and high bilirubin levels. Liver cancer, abnormal enzyme levels, requiring further imaging tests. Conclusion. Liver function tests provide essential insights into liver health and disease diagnosis. Understanding the significance of these tests helps guide treatment and monitoring strategies for optimal liver function. Imaging tests are essential for diagnosing liver conditions, evaluating structural abnormalities, and assessing liver function. Techniques such as MRI, CT scans, and ultrasounds provide non-invasive ways to visualize liver tissues, detect tumors, and identify bile duct obstructions. This essay explores these imaging methods, their applications, and how they contribute to liver disease diagnosis and management. Ultrasound imaging for liver assessment. 1. How it works. Uses high-frequency sound waves to create liver images. Provides real-time imaging of liver size, texture, and blood flow. 2. What it detects. Fatty liver disease. Liver cysts and tumors. Gallstones and bile duct obstructions. 3. Advantages and limitations. Non-invasive, cost-effective, and radiation-free. Limited in detecting deep tissue abnormalities or small tumors. CT scans for liver diagnosis. 1. How it works. Uses X-ray technology to generate detailed cross-sectional images. Contrast dye enhances visibility of liver structures. 2. What it detects. Liver tumors and metastases. Cirrhosis-related changes. Liver abscesses and vascular abnormalities. 3. Advantages and limitations. Provides high-resolution images but exposes patients to radiation. Contrast dye may pose risks for those with kidney issues. MRI scans for liver imaging. 1. How it works. Uses magnetic fields and radio waves to create detailed liver images. Contrast agents help enhance tissue differentiation. 2. What it detects. liver fibrosis and cirrhosis, liver tumors and cancer staging, bile duct abnormalities, MRCP technique. 3. Advantages and limitations. No radiation exposure, making it safer for long-term monitoring. Time-consuming and may not be suitable for claustrophobic patients. Liver imaging tests play a crucial role in diagnosing and monitoring liver diseases. Each technique has specific advantages, making them valuable tools in liver health assessment and treatment planning. Liver enzyme tests are an essential component of liver function assessments. By analyzing enzyme levels, medical professionals can detect liver damage, inflammation, and bile duct disorders. Understanding these test results is crucial for diagnosing and managing liver diseases. This essay explores how to interpret liver enzyme levels, what abnormal readings indicate, and how to address liver function abnormalities. Understanding liver enzymes. Liver enzymes play roles in metabolism and detoxification. Key enzymes include alanine aminotransferase, ALT measures liver inflammation and damage. Aspartate aminotransferase, AST indicates liver and muscle health. Alkaline phosphatase, ALP linked to bile duct function. Gamma-glutamyl transferase, GGT assesses bile duct and alcohol-related liver damage. What elevated liver enzymes indicate? Mild elevation, 1-2x normal medication side effects, mild liver inflammation. Moderate elevation, 3-5x normal viral hepatitis, fatty liver disease. Severe elevation, 5x normal acute liver injury, toxin exposure, advanced hepatitis. Factors that influence liver enzyme levels. Alcohol consumption increases AST and GGT. Obesity and diabetes contribute to elevated ALT and AST. Medications, statins, antibiotics, and NSAIDs can raise liver enzymes. Viral infections, hepatitis A, B, and C affect ALT and AST. Managing abnormal liver enzyme levels. Lifestyle changes, diet modification, regular exercise, and alcohol reduction. Medical treatment, addressing underlying conditions like hepatitis. Regular monitoring, periodic liver function tests to track progress. Conclusion. Interpreting liver enzyme levels is crucial for detecting liver disease and guiding treatment. Understanding what enzyme abnormalities indicate allows for timely medical intervention and lifestyle adjustments to maintain liver health. Liver disease is a major global health concern, affecting millions of people. Early and accurate diagnosis is crucial for effective treatment and management. While non-invasive tests such as blood work and imaging provide valuable information, liver biopsy remains the gold standard for definitive diagnosis. This procedure allows for direct examination of liver tissue, helping to identify disease severity, type, and progression. This essay explores the role of biopsy in diagnosing liver diseases, the different biopsy techniques, risks and benefits, and alternative diagnostic methods. Why is a liver biopsy performed? A liver biopsy is recommended when other diagnostic tests are inconclusive or when a more detailed understanding of liver pathology is required. It helps in diagnosing liver diseases such as hepatitis, cirrhosis, fatty liver disease, and liver cancer. Assessing disease severity by staging fibrosis and inflammation. Guiding treatment decisions based on liver damage. Monitoring disease progression and treatment response. Types of liver biopsy. 1. Percutaneous liver biopsy. The most common type, performed by inserting a needle through the skin into the liver. Usually guided by ultrasound or CT scan to ensure accuracy. Provides a small tissue sample for microscopic examination. 2. Transjugular liver biopsy. Involves inserting a catheter into the jugular vein, advancing it to the liver. Used for patients with blood clotting disorders or ascites, as it reduces the risk of bleeding. Allows measurement of hepatic venous pressure to assess portal hypertension. 3. Laparoscopic liver biopsy. Performed during laparoscopic surgery, allowing for direct visualization of the liver. Typically used when a larger sample is needed or when evaluating liver masses. Interpreting liver biopsy results. A liver biopsy provides crucial information about fibrosis and cirrhosis, determines the extent of liver scarring. Inflammation levels helps assess conditions like autoimmune hepatitis. Steatosis, fat accumulation, indicates fatty liver disease progression. Presence of cancerous cells confirms hepatocellular carcinoma or metastases. Risks and limitations of liver biopsy. Potential complications, bleeding, infection, or accidental injury to nearby organs. Sampling error. A small sample may not represent the entire liver condition. Patient discomfort. Some pain and discomfort post-procedure. Alternatives to liver biopsy. Non-invasive diagnostic tools include FibroScan. Elastography measures liver stiffness to assess fibrosis. MRI and CT scans provide structural imaging but lack histological detail. Serological biomarkers, blood tests like APRI and FB for estimate fibrosis levels. Conclusion. Liver biopsy remains an essential tool in diagnosing liver diseases, offering detailed insights into tissue pathology. While non-invasive tests are improving, biopsy continues to provide definitive diagnostic and prognostic information. Future advancements may further refine non-invasive alternatives, but for now, liver biopsy remains a cornerstone of liver disease assessment. Liver disease is often called a silent killer because symptoms may not appear until significant damage has occurred. Early detection is critical to prevent progression to liver failure, cirrhosis, or liver cancer. Recognizing early signs and seeking medical attention promptly can make a significant difference in treatment outcomes. This essay explores the early symptoms of liver disease, their causes, risk factors, and when to seek medical help. Common early signs of liver disease. 1. Fatigue and weakness. One of the first indicators of liver dysfunction. Results from metabolic imbalances and toxin accumulation in the bloodstream. 2. Jaundice, yellowing of skin and eyes. Occurs when bilirubin builds up due to impaired liver function. May indicate hepatitis, liver cirrhosis, or bile duct obstruction. 3. Dark urine and pale stools. Dark urine suggests excess bilirubin excretion. Pale stools indicate a lack of bile production, often seen in bile duct disease. 4. Nausea and loss of appetite. Liver dysfunction can affect digestion, leading to nausea and reduced appetite. Common in conditions like fatty liver disease and hepatitis. 5. Unexplained weight loss. A sudden drop in weight may indicate advanced liver disease, often linked to liver cancer or cirrhosis. 6. Abdominal swelling, ascites, and pain. Fluid accumulation in the abdomen is a sign of liver failure. Persistent right upper quadrant pain may suggest liver inflammation or tumors. 7. Increased bruising and bleeding. The liver produces clotting factors. Impaired function leads to easy bruising. Common in cirrhosis and chronic liver disease. 8. Itchy skin, pruritus. Bile salt accumulation in the bloodstream causes persistent itching, often seen in cholestatic liver diseases like primary biliary cholangitis. 9. Swollen legs and feet edema. Due to fluid retention from low albumin levels, a protein made by the liver. Common in late-stage liver disease. Causes and risk factors of liver disease. Excessive alcohol consumption leads to alcoholic liver disease. Viral hepatitis A, B, C can cause chronic liver inflammation. Obesity and diabetes increase the risk of NAFLD. Autoimmune disorders cause liver inflammation and damage. Genetic conditions, such as hemochromatosis and Wilson's disease, affect liver metabolism. Exposure to toxins and medications, certain drugs and chemicals can lead to liver toxicity. When to see a doctor. Seek medical attention if persistent jaundice, dark urine, or pale stools appear. You experience unexplained weight loss or fatigue. Abdominal pain or swelling occurs. You have a history of liver disease or risk factors like excessive alcohol use. Diagnostic tests for liver disease. Liver function tests, LFTs assess enzyme levels and bilirubin. Imaging tests, ultrasound, MRI, or CT scans evaluate liver structure. FibroScan measures liver stiffness to detect fibrosis. Liver biopsy provides a definitive diagnosis for chronic liver conditions. Preventing liver disease. Maintain a healthy diet, Avoid processed foods and excessive fats. Limit alcohol intake, moderate drinking, or complete abstinence for those at risk. Exercise regularly helps maintain healthy liver function. Vaccination prevents hepatitis A and B infections. Routine health screenings, early detection improves outcomes. Conclusion: recognizing the early signs of liver disease and seeking prompt medical attention can prevent severe complications. Regular checkups, a healthy lifestyle, and awareness of risk factors are crucial in maintaining liver health. If symptoms appear, timely intervention can make a significant difference in treatment success and overall well-being. The liver plays a crucial role in maintaining the body's acid-base balance, ensuring that pH levels remain within a narrow, optimal range. This balance is essential for various physiological functions, including enzymatic activity, cellular metabolism, and overall homeostasis. The liver achieves this regulation through buffering mechanisms, metabolism of acids and bases, and detoxification processes. This essay explores the mechanisms through which the liver contributes to acid-base balance, its interaction with other organs, and the consequences of liver dysfunction on systemic pH regulation. Understanding acid-base balance. Acid-base balance refers to the regulation of hydrogen ion, H, concentration in the body, maintaining a stable blood pH between 7.35 and 7.45. Major systems involved in this regulation include the bicarbonate buffer system, respiratory regulation, lungs, renal regulation, kidneys, hepatic metabolic functions. The liver's role in acid-base homeostasis. 1. Ammonia detoxification and urea cycle. The liver converts ammonia, NH3, a highly toxic byproduct of protein metabolism, into urea, which is excreted by the kidneys. This process prevents metabolic alkalosis, a condition where excessive bicarbonate levels disrupt pH balance. 2. Lactate metabolism and the Cori cycle. The liver clears lactic acid produced during anaerobic respiration, converts lactate into glucose via gluconeogenesis, preventing metabolic acidosis. 3. Regulation of bicarbonate and organic acids. The liver metabolizes organic acids such as ketones, adjusting bicarbonate levels to stabilize pH. It also regulates carbon dioxide, CO2, buffering, interacting with the lungs to maintain acid-base equilibrium. Impact of liver dysfunction on acid-base balance. Liver cirrhosis and acidosis. Impaired liver function leads to lactate accumulation, resulting in lactic acidosis. Hepatic encephalopathy and ammonia toxicity. Inefficient ammonia detoxification causes alkalosis and neurological symptoms. Acid-base imbalances in liver disease. Metabolic acidosis and impaired gluconeogenesis are common in advanced liver disorders. Conclusion: the liver is integral to acid-base homeostasis through its role in ammonia detoxification, lactate clearance, and organic acid metabolism. Liver dysfunction can lead to severe pH imbalances, emphasizing the importance of liver health in maintaining systemic equilibrium. The liver serves as the primary metabolic hub of the body, regulating carbohydrate storage and energy distribution. It plays a key role in maintaining blood glucose homeostasis, ensuring that the body has a steady supply of energy during fasting and feeding states. The liver achieves this through glycogenesis, glycogenolysis, and gluconeogenesis, allowing it to store, release, and synthesize glucose as needed. This essay explores the liver's role in carbohydrate metabolism, its interaction with insulin and glucagon, and the consequences of liver dysfunction on energy balance. Key functions of the liver in carbohydrate metabolism. 1. Glycogenesis, storing excess glucose. After carbohydrate-rich meals, excess glucose is stored as glycogen in the liver. Insulin, released by the pancreas, stimulates glycogenesis, ensuring excess glucose is not lost. 2. Glycogenolysis, releasing stored glucose. During fasting or energy deficits, the liver breaks down glycogen into glucose. Glucagon, secreted by the pancreas, signals the liver to release glucose into circulation. 3. Gluconeogenesis, synthesizing new glucose. When glycogen stores are depleted, the liver produces glucose from non-carbohydrate sources, including amino acids, lactate, and glycerol. This process is crucial during prolonged fasting and exercise. The liver's interaction with hormones. Insulin promotes glucose uptake and storage. Glucagon stimulates glycogen breakdown and glucose production. Cortisol and epinephrine enhance gluconeogenesis during stress and fasting. Liver dysfunction and energy imbalances. Hypoglycemia, low blood sugar impaired glycogenolysis leads to dangerously low glucose levels. Hyperglycemia and diabetes, fatty liver disease, and insulin resistance disrupt normal glucose regulation. Glycogen storage disorders, genetic conditions impair glycogen synthesis and breakdown. Conclusion. The liver's role in carbohydrate metabolism is essential for maintaining energy homeostasis. Through glycogenesis, glycogenolysis, and gluconeogenesis, the liver ensures a constant glucose supply. Liver diseases can severely impact energy metabolism, highlighting the importance of liver health in overall metabolic balance. The liver possesses a remarkable ability to regenerate, making it one of the most resilient organs in the human body. Unlike other organs, the liver can recover from injury and regrow lost tissue, restoring its full function. This regenerative capability is crucial for liver transplantation, recovery from diseases like hepatitis, and repair following surgical resection. This essay explores the mechanisms of liver regeneration, the role of stem cells and growth factors, and how diseases affect the liver's ability to repair itself. Mechanisms of liver regeneration. Liver regeneration occurs primarily through hepatocyte proliferation rather than stem cell activation. Key steps include: 1. Hepatocyte proliferation. Mature liver cells, hepatocytes, replicate and divide to replace lost tissue. Unlike other organs, the liver does not rely on stem cells under normal conditions. 2. Growth factor activation. Hepatocyte growth factor, HGF, stimulates hepatocyte proliferation and tissue repair. Epidermal growth factor, EGF, enhances cell division. Transforming growth factor alpha, TGF-alpha, supports liver regrowth. 3. Extracellular matrix remodeling. The liver modifies its extracellular matrix to support new tissue formation. Fibroblasts and immune cells contribute to the wound healing process. Liver regeneration in disease and injury. Partial hepatectomy. The liver can regenerate up to 70% of its mass after surgical removal. Hepatitis recovery. Viral infections trigger regeneration, but chronic inflammation can cause fibrosis. Cirrhosis and regenerative failure. In severe liver disease, excessive scar tissue, fibrosis, inhibits regeneration. Factors that affect liver regeneration. Age and genetics. Younger individuals regenerate liver tissue more efficiently. Nutrition. Protein and vitamin-rich diets enhance recovery. Chronic liver disease. Long-term alcohol use or hepatitis reduces regenerative capacity. Enhancing liver regeneration. Liver transplant advances. Research explores regenerative medicine for improving transplant success. Stem cell therapy investigates the role of liver progenitor cells in aiding regeneration. Pharmacological interventions. Growth factor therapies show promise in stimulating liver repair. Conclusion. The liver's plasticity and regenerative abilities make it unique among organs. Understanding these mechanisms opens the door for innovative treatments for liver disease, transplantation, and recovery from injury. Protecting liver health ensures that its regenerative potential remains intact, maintaining metabolic and detoxification functions. The liver is primarily known for its role in metabolism, detoxification, and digestion, but it also plays a significant role in endocrine function. It interacts with various hormonal systems, including the thyroid and adrenal glands, to regulate metabolism, stress response, and energy balance. This essay explores the endocrine functions of the liver, its role in hormone metabolism, and its interaction with the thyroid and adrenal glands. Endocrine functions of the liver. The liver is both an endocrine organ and a key regulator of hormonal balance. Its functions include: Metabolism of hormones. The liver modifies, activates, and deactivates various hormones. Production of hormone-binding proteins, such as thyroxine-binding globulin, TBG, for thyroid hormones, and cortisol-binding globulin, CBG, for adrenal hormones. Synthesis of insulin-like growth factor, 1, IGF. 1 regulates growth and metabolism. Regulation of glucose homeostasis influences insulin and glucagon activity. Interaction with the thyroid gland. Thyroid hormone conversion. The liver converts thyroxine, T4, into triiodothyronine, T3, the active thyroid hormone. Liver dysfunction can lead to low T3 levels, euthyroid sick syndrome. Thyroid hormone transport. The liver produces TBG, which binds and transports thyroid hormones in the blood. Liver disease can reduce TBG production, altering thyroid function. Interaction with the adrenal glands. Cortisol metabolism. The liver deactivates excess cortisol, preventing prolonged stress responses. Impaired liver function can lead to cortisol imbalances, causing adrenal dysfunction. Aldosterone and fluid balance. The liver influences aldosterone clearance, affecting sodium and water retention. Liver cirrhosis can lead to hyperaldosteronism and fluid imbalance. Liver dysfunction and hormonal imbalances. Hypothyroidism, reduced T3 conversion affects metabolism. Adrenal fatigue, excess cortisol accumulation impacts stress response. Insulin resistance, liver impairment affects glucose regulation. Conclusion. The liver plays a vital role in hormonal regulation, working closely with the thyroid and adrenal glands. Maintaining liver health is essential for endocrine balance, metabolic regulation, and overall well-being. The liver is the body's primary site of protein synthesis and nitrogen metabolism. It produces essential proteins, regulates amino acid levels, and detoxifies nitrogenous waste. This essay explores the liver's role in protein metabolism, nitrogen balance, and the consequences of liver dysfunction on protein synthesis. Protein synthesis in the liver. The liver synthesizes albumin, maintains blood pressure and fluid balance. Clotting factors, essential for blood coagulation. Transport proteins, carry hormones, vitamins, and minerals. Nitrogen metabolism and detoxification. Amino acid metabolism. The liver modifies amino acids for energy or protein synthesis. Converts excess amino acids into glucose, gluconeogenesis. Urea cycle and ammonia detoxification. The liver converts toxic ammonia, NH3, into urea, excreted by the kidneys. Hepatic encephalopathy occurs when ammonia accumulates due to liver failure. Consequences of liver dysfunction. Hypoalbuminemia. Leads to fluid retention, ascites, edema. Clotting disorders, increased bleeding due to reduced clotting factor production. Hyperammonemia, ammonia buildup affects brain function. Conclusion. The liver is essential for protein synthesis and nitrogen metabolism. Liver dysfunction can lead to severe metabolic imbalances, underscoring the need for proper liver care. The liver is responsible for producing most of the body's clotting factors, which prevent excessive bleeding. Impaired liver function can lead to bleeding disorders and increased clotting risk. This essay explores the liver's role in coagulation, the impact of liver disease on blood clotting, and treatment options. The liver's role in coagulation. Produces clotting factors 1, 2, V, 7, 9, X, 11. Synthesizes anticoagulant proteins like protein C and S. Metabolizes vitamin K, essential for clotting factor activation. Liver disease and coagulation disorders. Increased bleeding tendency. Cirrhosis and hepatitis. Reduced clotting factor production leads to easy bruising and prolonged bleeding. Increased clot formation. Liver disease paradox. While some patients bleed easily, others develop blood clots, portal vein thrombosis. Managing clotting disorders in liver disease. Vitamin K supplementation helps restore clotting factor function. Plasma transfusions provide missing clotting proteins. Anticoagulants used cautiously in patients with clotting complications. Conclusion. The liver plays a central role in blood clotting regulation. Liver dysfunction disrupts coagulation balance, increasing the risk of bleeding or clot formation. The liver and kidneys work together to regulate fluid balance, blood pressure, and toxin clearance. Liver dysfunction can impair kidney function, leading to complications such as hepatorenal syndrome, HRS. This essay explores the liver-kidney connection, fluid regulation, and the impact of liver disease on kidney health. The liver's role in fluid balance. Albumin production maintains oncotic pressure, preventing fluid loss. Aldosterone clearance regulates sodium retention and water balance. Hepatorenal syndrome, HRS, a severe kidney disorder caused by liver failure, leads to rapid kidney dysfunction, low urine output, and fluid overload. Managing liver-induced kidney issues. Diuretics help remove excess fluid. Liver transplant, only definitive cure for HRS. Albumin infusions improve circulation and kidney function. Conclusion. Liver dysfunction significantly impacts kidney function and fluid balance. Protecting liver health is essential for maintaining renal stability. Liver disease can have severe neurological consequences, affecting cognitive function, memory, and motor skills. The most serious condition, hepatic encephalopathy, HE, occurs due to toxin buildup in the brain. This essay examines how liver dysfunction affects the nervous system and strategies for prevention. How the liver supports brain health. Ammonia detoxification prevents neurotoxicity, regulates nutrient supply, supports brain function, metabolizes neurotransmitters, ensures balanced dopamine and serotonin levels. Neurological effects of liver dysfunction. Hepatic encephalopathy, HE confusion, tremors, coma. Cognitive impairment, memory loss, poor concentration. Peripheral neuropathy, nerve damage and advanced liver disease. Managing liver-related neurological issues. Lactulose therapy reduces ammonia levels. High-fiber diet supports gut-liver health. Liver transplant restores normal brain function. Conclusion. Liver health is crucial for brain function. Preventing liver disease helps protect against neurological decline and cognitive impairment.